The rising cases of HFMD taking its toll on children has got the entire planet community under the pressure of keeping their kids away from the gripping claws of this contagious disease while sending them off to schools. But what exactly is this disease about? What are its symptoms? And how can your kids fight it? We have Dr. Vandana Saxsena with us, who is a renowned pediatrician at Annexa's clinic with 31 years of overall experience in this field to help us answer all these questions. Good morning, ma'am. Thank you so much for doing this interview with us. So, if you could please tell us what
Good
exactly is
morning.
HFMD about and how does it spread?
The HFMD, as its name says, it's hand, foot, mouth disease. So this is a viral disease, and it spreads through some enteroviruses. There are a group of viruses, such as Coxsackie A, B, and some enterovirus 71, which can cause these diseases. So this spreads from person to person, and it's a form of viral which people understand like chicken pox and all, but it's not. The lesions look like them, but it's not. It is caused by a different virus, and it usually affects the children below 5 years of age, and they developed fever usually, and sore throat, refusal to eat, and then the rashes come. This rashes typically comes in the throat first, and then it comes around the mouth, the hands, and the feet, but it can come in other areas in the gluteal region. And the child usually cranky and feels decreased appetite and drooling of the saliva because of the mouth lesions. And usually the child is having more problems because of the mouth lesions. The hand and the foot lesions are just the parents can see it and they become more scared, but usually these lesions don't cause any trouble much to the child. Like in chickenpox, there's not much itching and all, but basically the throat lesions, which we also known as herpangia, which causes severe pain in the throat, and this makes the child not eat. And the recovery is takes 7 to 10 days. Usually 10 days it takes for the recovery. In that period, the lesions may increase and slowly settle down without leaving any mark, and it the settles down. So most the cases, 80-90% of the cases are self-limiting and they become all right. But we have to know there are certain danger signs, and some children may go into complications of HFMD, which can be serious, like neurological, cardiac complications, and that has to be kept in mind, which is more caused by enterovirus. There are different kind of virus. So Coxsackie viruses usually are self-limited, but enteroviruses can cause a severe disease.
All right, all right.
Mm.
So, what kind of precautions can the parents take to keep their kids safe?
First of all, the more responsibility lies on the schools and the preschools and the play schools to screen the children who are coming to their school with having some lesions or fever or cough and cold. They should not allow those children, because this disease spreads very fast. It spreads from one person to another person. Even if the person is not there, by the touch, like COVID, the surfaces you touch and then you touch your hand and mouth with the same hand, it will spread. Parents also should take the responsibility. If the child is unwell, don't send the child to the school, since this disease is usually present less than 5 years of age in children. So we should treat the 5 year less children school as a play school and not be very strict. Like if they are unwell, you should not send them to school. And hand washing goes in a big way in preventing these diseases. So caretakers at school and home, they see that the children should wash their hands properly frequently, which will prevent the transmission of disease from the surfaces to their children.
Okay, all right. So, there's, in the recent news, there are schools being closed in Chandigarh. So, why do you think there's a sudden rise in the HFMD cases? And do you think closing schools and shifting to online is a good solution to it?
So rise of cases of HFMD can be because the schools have opened after 2 years. I'm not only saying HFMD increase, all sorts of respiratory infections, all sorts of viral RTIs, everything has increased because because of the 2 years of lockdowns, the children are not exposed. They are in a protected atmosphere. So when they go back to school again, the viruses are spreading because they also have found a nice cohort which have not got exposed to these infections earlier in their life, and then they are getting exposed. So similarly, HFMD, we do see lot of this earlier also, before COVID also, we have seen outbreaks here and there about HMFD. But now again, because of the school reopening, it has come back again. So closing the school, yeah, if there are number of cases are frequently increasing and a very high number in a school or a play school, it's a good idea to stop the children coming there for a desired maybe a 10 days or 2 weeks halt, which breaks the chain, and then we can start, because the children are going to school after a long hiatus, and we should not deny them for the pleasure of going to school. That's very important in their development.
Right.
So that cleanization of the school area complete, they can do the sanitization and then reopen the school, and this will also help in breaking the chain of the HFMD cases.
Right, right. So, what kind of treatments have been developed to cure this disease?
See, it's a self-limiting disease. It gets cured on its own. You just require paracetamol or some painkillers and some local painkillers in the throat to apply so that the pain and all is less in the throat, and some calamine lotions on the rashes so that they heal properly. So as I told, 80-90% get cured on its own, and you don't require anything, only symptomatic treatment. Yeah, in complicated cases, the doctor will tell you about the danger signs, which can be like the child is very tired, dehydrated, you feel he's lying down, or he shows some tremors, jerks, or feels dizzy. These things, if the child is feeling, you can immediately go to the nearby hospital, and they will check his vitals and do some tests. And if we think that it's complicating, then there are immunoglobulins and all which can be taken care to take the treatment to do the treatment of HFMD.
All right. And just one last question. We live in a world of a lot of false rumors about various diseases. So, what are the few myths that exist around HFMD that you'd like to bust?
Uh, One thing is as we tell always, like it's mostly affecting children, but it's not that it cannot affect adolescents and adults. It can affect adolescents and adults, and sometimes the adults may be asymptomatic, means they will not have the symptoms, but they will may act as carriers, and it can get transmitted to other person to an adult. Another thing is you cannot get a HFMD once more. So it's caused by many viruses. So you can get more HFMD. It's not a one-time disease like chickenpox. It can come back again. And mm, uh, regarding breastfeeding mothers, they should continue the baby feeding the breast milk even if he has HFMD or something, because it will not get transmitted through the breast milk. And HFMD usually a self-limiting disease. It is a self-limiting disease, but there are chances it can complicate. So please be on a look that if there is any danger signs you are seeing in the child, especially the main thing in a child who has got fever for any cause, if the child is dull, not eating, lethargic, irritable, it's better to consult a doctor immediately, because there may be some complication regarding HFMD.
All right. So, thank you so much, ma'am, for answering all these questions with utmost patience and experience. We sure did learn a lot of things from you. Thank you so much.
Thank you, Shubhangi. Thank you for inviting me to your show and giving me the opportunity to speak about HFMD. Thank you very
Thank you
much.
so much. It was lovely interacting with you, ma'am.